some real world advice, a safe place to go where you're treated right. We're all in the same boat, come on, take some crib notes. We're all in the same boat, come on, take some crib notes.
Hi, I'm Kaylee.
And I'm Cait.
And this is Crib Notes.
And we're here as your nurse practitioner specializing in pediatric healthcare to talk to you about RSV.
We decided to talk about RSV today because we're seeing an unprecedented amount of RSV this early in the year. Typically, we see it like November to April. But we're seeing it a little bit early this year because COVID likes to mix everything up.
Exactly.
And also people are calling it, the twindemic?
Mm-hmm.
Because we're seeing so much of the two things at the same time.
Yeah, and sometimes it can be difficult to distinguish the symptoms from COVID from RSV because they can present somewhat similarly.
So what's RSV?
Yeah, RSV is respiratory syncytial virus. It's a common viral illness, again, that we see most of the time in the winter, although we're seeing it much earlier this year. And it causes, for the youngest children, copious amounts of nasal secretions, really congested, junky, productive cough, wheezing, sometimes difficulty breathing, whereas in the older children or even adults, it may present just like a common cold without as significant symptoms.
Mm-hmm.
What we do know is that most children, by the time they're 2, have been infected with RSV.
But that once you've had it, subsequent infections aren't going to be quite as bad, most likely. RSV is typically transmitted through respiratory droplets, so coughing, sneezing. It is not airborne, typically, so it's not something that lives in the air for a long time after you've left a room, but it can live on surfaces for several hours and sometimes lives on our hands for a slightly shorter time.
Mm-hmm. Which is why those children in daycare settings, childcare settings are at such high risk because it can live on the toys and the things that they're interacting with, and we know that young children have such close contact with one another. So when you're talking to your patients about RSV, what do you tell them in terms of course of illness?
So the biggest takeaway from the course of illness with RSV is how long it lasts. Some kids are sick for 10, 14, even 21 days. Typically symptoms are going to peak between days 3 and 5, and they will, after that start to slowly subside.
Yeah, but it's not uncommon that we see kids come back sometimes 2-3 weeks after being diagnosed with RSV and continue to cough. And what's important is that we'll try to educate parents that this is really a viral infection. It just takes time for that to resolve. What we would be looking for is, symptoms to be improving over that period of time rather than getting worse.
When do we worry about RSV?
Yeah, the things that we worry about, again, in the youngest children, so our infants and our toddlers and certainly our newborns, what we're looking for is signs of respiratory distress. Those things, and when I educate parents about rapid breathing, so if your child seems to be breathing more rapidly than normal, if they're having retractions, which is kind of tugging in between the rib spaces or above the clavicle or under the sternum, if you can see it sucking in, we call that retractions, and that's a sign of distress. Another sign would be nasal flaring, so the nostrils are flaring with every breath. That would be worrisome. There are a couple other things like dehydration. Sometimes when babies are sick with RSV, they don't want to eat, they don't want to drink, and we worry about dehydration. I'm most worried about newborns, so that would be birth to 1 month of age, because we know that they have risk for more severe disease and worse outcomes than other children. But also premature infants we worry a whole lot about. So those are babies that are born before 37 weeks gestation. We know the same, more severe illness and risk for worse outcomes. But there are some things that we can do for those premature babies. You want to tell them? Kaylee?
So fortunately, there is an RSV vaccine called Synagis. We offer this vaccine to babies that are born very premature, usually 29 weeks and before. And we also offer it to babies who are born with certain medical conditions like congenital heart disease and that sort of thing. This vaccine can prevent RSV, but it also can decrease the severity of RSV infection if your infant does contract the virus.
Usually offer this vaccine November to April, but because of the change in viral patterns that we're seeing, the newest recommendation is to offer that vaccine to those premature babies that qualify starting now. So if that applies to you and you're one of our patients, reach out to us and we will be reaching out to you, but also to the other out there, and reach out to your pediatric provider and talk about this. So, in summary, RSV is a common respiratory virus. For most children, it has a mild course: cough, congestion, wheezing. However, if you see signs of increased work of breathing, dehydration, lethargy, tiredness, those are times that we would want you to reach out to us. Remember, RSV lasts anywhere up to 2 to 3 weeks, with peak of illness being at day 3 to 5. For most children, supportive care is the only treatment. Tylenol, Motrin, fluids, and a lot of extra love. So thank you for joining us for this episode of Crib Notes.
Please always remember that your child's care is nuanced by their unique physical makeup, as well as your family's particular economic, social, and environmental circumstances. For that reason, always reach out to your own pediatric care providers with any questions about your child's health.
And don't forget to like and subscribe.
And leave your questions in the comments so we can address them in future videos.
Thanks.